Good evening, good evening, good evening. And this is the Vantage Point, where we inform, infuse, and inspire you. Of course, with pertinent information, things that you need to know. And of course, we are here to help you live the very best life that you can live. We know that if you have the right information, if you have the right inspiration, you can not only just survive, but you can thrive in this world. And I'm committed, my whole life is committed to helping people, to lifting people, to inspiring people, to communicating with people so that we all can live a better quality of life. Well, tonight's Vantage Point, by the way, this is Bishop Edgar Vann, and I'm your host tonight for the Vantage Point. Tonight is going to be a very, very special presentation. Tonight, our theme is what about the children? We've heard everything we can, many of us ad nauseum about the pandemic, about vaccines. We've experienced throughout this pandemic so many of our loved ones who are gone, friends who are gone, over 780,000 people in the United States of America have passed away because of this tragic and unprecedented virus. However, we know that there is hope and there is help. And that's what we want to talk about tonight. We want to give you the straight facts. We want to help you understand the necessities and the needs that you have. Most especially tonight, our focus is on the children. Our children, who we call our future, right? We want to make sure that our children are protected. We're concerned about their health and their safety. We want to make sure that we are raising our children and raising a generation in an environment, in an atmosphere that is conducive to a great quality of life. They deserve everything that we can do for them. And tonight, I know that there are parents. I've had calls already. I've had messages from people already who are anxious to hear this forum tonight so that you can have exactly what you need to be able to make the proper decisions for your children. We see a new variant is out, Omicron. This new variant, it was reported today, has now infiltrated its third state in the United States. Just yesterday, it was one state, California. Now there are 3 states, and there's more predicted and forecasted to come. What we want to do tonight is give you good, solid information as it relates to your child, your grandchildren, your nieces, your nephews, whoever might be in your sphere of influence, that you have an opportunity to make sure that they have the right quality of life. I have with me 2 of the very best people that I could ever have with us on tonight sharing in this forum. First of all, I have with me a good friend, a labor leader, a community leader, an education leader, a civic leader, Angelique Peterson Mayberry, who is the board president of the Detroit Public Schools Community District with us. I'm so glad to have you tonight, Angelique. It's a blessing for you to be with us. And then I also have with us Dr. Nakia Allen, who is a senior staff physician at Henry Ford Health System here in our city, and is also a clinical associate professor at Wayne State University. She is now the director of pediatric education for the Department of Pediatrics for Henry Ford Health System. A good, solid sister is with us tonight, sharing with us. Welcome, Dr. Allen.
Thank you so much for having me.
Well, listen, what I want to do starting out initially is get some initial remarks from both of you from your perspectives. Certainly, Angelique Peterson Mayberry, we're talking about our kids who are part of the district here in Detroit. We know that there are other districts. We know that there are other schools but this is the predominant education delivery system for our children here in Detroit. And we want to hear from you just exactly how this pandemic has affected the delivery of education. What kinds of things is DPS CD doing to address our young people in this day and time? Are you offering vaccinations for the students? If so, how successful is that? Are you communicating with the parents with regard to this pandemic? What has your level of communication been, and how are you steering or directing or encouraging parents to have now their children vaccinated? We know that there have been outbreaks in not just DPS CD, but there have been outbreaks throughout the state and the region here with schools. And I'd love for you, and I know that this is a little bit off subject, but it's not really for me, because health and safety go together. We know that there's been a very tragic and horrific shooting that has taken place. I know it's in Oakland County and Oxford, outside of Pontiac, et cetera. However, we know that violence in this day and time knows no name, no address, no location, no region. Certainly, I think it would be timely if you could just initially address that situation as an education leader in our community, as well as a mother in our community, and then go ahead and talk to us about Detroit Public School Community District and just exactly what is taking place and has been taking place throughout this pandemic. Angelique?
Thank you. Well, thank you, Bishop, for having me. This is an extremely humbling opportunity to come and speak before you today and the community. I listen to you on social media, I watch you, and I stay connected so that I know what's going on. So thank you for that. I think it would absolutely be appropriate to offer our condolences to the Oxford community. I don't care where you stay, these are children. And no parent means the parent's worst is fear. Their worst fear is to send their student to school, a place where they not only are being educated, but the expectation is that they're being kept safe. And then their student not return, or to get that call. Ironically enough, I was with a mother of someone who has a student who goes to Oxford yesterday when it happened. And I instantly start praying because I just couldn't imagine. It's unimaginable. And so we do want to wrap our arms around that entire community in Oxford. And I think it just speaks to the level of just the space that we're in right now, where there's this uneasiness about society. And you're right, no one is immune to this. And no, it did not happen in Detroit as the largest district. However, it happened to students. And we had educators there, and our first responders are there. And so, you have to sympathize with them to think about what is it that we are doing to try to protect our young people while they're in our care. So the making sure that you have gone through not just the drills around fire and weather, but active shooter training. And it's sad to say, but churches are doing it, organizations are doing it, and yes, school buildings are doing it. And DPS CD has absolutely done that as well. COVID prevented us from continuing that. So there was this break. However, we are now reinstituting those drills, and those drills are kept on record in the office of every school so that you could see that they are taking place. So we just want to, lift that up and make sure that people understand that that happens. Detroit, received a lot of pushback because we are one of the only districts with our own public safety department. And I call them public safety and not police, because they don't just police kids, but they are making sure that the learning environment is safe for our young people from the external variables that may try to come into the school. And then if people try to disturb the educational climate in the school. And so, they do so much more than what people think. So public safety, yes, we have our own, we train them. So the training is specific to what we want. They know our families, they know our students, and they're there. And I think that that is something to be lifted up as well as we talk about, how do we try to make sure that our young people are safe? So I did want to mention that about as we have our condolences sent to the Oxford community and lifting them all up in prayers. So thank you, Bishop, for allowing me the opportunity to address that. So DPSCD, leading now is one of the most difficult tasks that a person will have, especially if they're dealing in education, because in this time, we have had our faith tested. It's been shook. Everything that we thought we knew in terms of making these decisions, we were on the pathway. Our trajectory prior to COVID was climbing. We had the highest test scores in the state. Teacher vacancy was down, enrollment was up. We were doing all these amazing things, programs and partners and, all this support. And then COVID hit. And when COVID hit, we had to think quick and we had to think long and hard about what we needed to do. And so it was difficult to think about us being thrust into an online learning only platform, because we know that for a majority of our young people, that is not the best learning platform. So everyone, when COVID hit and we had to shift to that, a lot of us felt as if we were failing some of our families and our students. We have a large population of special education students who needed to be in the building. We have students who just needed to be in front of educators, and we could not do that at the time when things shut down. So we went into this, we started thinking immediately about what the plan would look like when that ban was lifted so that we can go back into the building. So we were one of the first districts that went back into the building in the summer because we realized that our young people needed something to do in the summer. So it wasn't just about academics, but it was also about enrichment and enhancement. I'm proud to say that our district is one of the few districts, I think one of the only districts that is testing. So we are testing weekly. And we are spending COVID dollars for that. It's costing us about $70 million to test our young people and our educators and those who come into our building who want to have the test. We are offering those opportunities for testing weekly for those who come into our buildings. And so we have the mask mandate. We're appreciative that the governor came out and said, but we were not going to wait. We knew it was the right thing to do. So we were the first district to come out and say, we have this mask mandate. And if you're coming into our building, you will have the mask, the temperature check, the symptom check, the social distancing, the signage. Those are all things that we initially came out with. And we came to the community with our reopening plan. So these decisions were not made in a silo. However, we were trying to get people to understand our best thinking and then hear from the community so that they understood where we were and where we were trying to go and how we needed to get there. But there were a couple of things that happened during the pandemic that our eyes were made more widely open to. One is the technology disparity. And so, some districts already had the privilege of having online learning taking place in their communities. We had not yet gotten to that point. We were on a 1-to-1 ratio for devices. So if you came into our building, you did have a device. However, when we were thrust into this online learning, our students did not have devices. And so it was the leadership of Reverend Wendell Anthony and DTE and Ralph Wilson Foundation and the Skillman Foundation. I mean, there were a lot of partners who said, how can we help? And so Connected Futures was born, and that's a $23 million project where we gave out almost 45,000 computers. Not only did we give out computers, but we made sure that they had connectivity and internet access. So that was the first thing that we needed to do, because while our students were at home, we realized that they're at home and they're not learning. So we did that. In addition, we had to open up because some of our students, they needed to be in the building for like food. So we had grab and go centers where we gave out over 1 million meals during that time, as well as community hubs. We were visiting homes. We had a Are You Okay campaign, knocking on doors, just trying to make sure people are okay. We initiated the homework hotline. We initiated the mental health hotline, because that's a space for African Americans, and I'm sure Doc may speak about that later, but we've got to remove the stigma around mental health and it being something that is not this thing that you want to publicly say that you need help to, especially as a brown person, a Black and brown person. I can remember being raised and, my mom and grandma, you better not take our business out this house, right? And it's like, but if I need help, then I need help. And I think that we see now, even from the Oxford situation, we see now that our young people need help. So those are some of the things that as COVID hit, and then Bishop, I'm a mom. I'm a mom. I have two children, 19 and 22 years old. And, people need to understand that although we may be leaders in our respective spaces, we're in COVID too. My daughter had COVID. So it was a very scary time for me because thank God she was not admitted into the hospital. However, it was touch and go. We didn't know what to do. We had never experienced this. We didn't know how it was going to affect her body. And so, I think that grace that we ask for people to have, even for our leaders, we need to have it because they too are in COVID. It's not isolated to certain spaces, but we are all in it. And I think that, as we lead in this space and live in this space, we also have to learn how to work in this space, educate in this space, worship in this space. COVID is here. And so we have to learn how to do so and do so safely.
Well, that's just great. Thank you so much for that perspective coming from our educational district and institution here in Detroit. And there were just so many ways in which the district had to pivot in order to meet the needs, in order to communicate with families. That kind of outreach was something I'm sure that you guys have learned some great lessons from for the future in terms of the connectivity that you've had with the community at large during a time like this. Thanks so much. We're coming right back to you. I want to introduce my next guest. My next guest is Dr. Nakia Allen. Dr. Allen is, again, the Director of Pediatric Education for the Department of Pediatrics for Henry Ford Health System. She's also a professor at Wayne State University as it relates to pediatric medicine. And Dr. Allen, welcome.
Thank you so much. I am so, again, happy to be here. And I keep saying that because I don't take it for granted that the community needs to see us. We have been extremely busy in pediatrics in a variety of ways, working along with the community members to look after our children in this great time of uncertainty. Bishop, if I may, I did also want to address what happened in Oxford. And what I see here is some challenges that we have as a health system on all points. We're going to have to take limited resources. Statewide, there are very few mental health options available. And we just don't have enough, actually, is what it is. And we need to make sure that our parents understand the resources that are out there. How do you even bring up what happened to your child? Should you bring up what happened to your child? And what happens if they have a reaction? What happens if you do? I'm also a mother. My child is 6. And, how do I go about addressing what happened in that environment with someone of that age? And we really do lean on to our schools, we lean on to our churches, and we're really looking for the guidance because we don't know. And I think that's one thing that is important to understand. We don't know how our children will react to that, how to keep them safe, what happens. If you don't talk to your children, you don't say anything, do you trust the community that you're in? We don't even know each other, honestly. So would you trust the community that you're in to comfort your child if they happen to hear something when you haven't had a chance to discuss what happened? So I highly encourage, if you don't have the words, definitely there are resources out there to help you. The National Childhood Traumatic Stress Network resources are out there. And reach out to your community and find out what we can say to help protect our children. If anything, with schools closing, a lot of schools closing today, they may have questions about that. Why am I not in school? So anyone who is trying to avoid it, it's kind of hard now. So that might be for today and tomorrow. So definitely reach out to your children, give them a hug. I know I gave mine lots of hugs, and we really thought about what the morning looked like. I know a lot of us are busy trying to return to whatever we're returning to, getting our day started. And we all were children trying to get out of the house in the morning. And sometimes we're a little more rushed than what we probably should be, or a little more short. But you know what, even stopping to tell your child, I love you today, and I can't wait to see you when you get home, because unfortunately that's not always the case. So definitely reaching out and supporting your loved ones at this time, all times, but definitely times like this. Speaking of things and not knowing from the health system, the pandemic definitely was something that hit us really, really hard from a pediatric perspective. And that's because at the very beginning of the pandemic, the number one word you would hear is, well, it's not really affecting children that much. And then we heard, well, they're not really getting sick. And well, maybe they don't need to go to the doctor. And we as a health system pivoted. So we immediately actually canceled, which is interesting to hear. We canceled our appointments for our older children, our school-age children, and we prioritized our children from birth to 2, which many hospital systems in the area did. So we were working on a mobile bus, seeing newborns, making sure those mothers were safe and that they didn't come into an environment where they might be exposed to COVID, which was hard. I remember working Easter Sunday, trying to see these newborns to make sure that they were safe, because we do have to see them frequently. And then what happened was we would check in on our older children, but we weren't seeing them in clinic. So we needed to find ways to reach out to them. Those who have some learning disabilities, those who might have ADHD. In our clinic in particular, we pivoted. We had canceled the appointments, the system did. So we were not as busy as usual. We actually took the time to find packets while the school systems were pivoting. And we printed out packets and say, here's a worksheet. Please read this book with your child. Here, let us help you. Oftentimes throughout the pandemic, as it progressed, grandma, grandpa, they didn't really know how to get onto the internet. So we might stop and say, okay, are you on Zoom? Mute your screen. I'm about to listen to your chest right now. We wanted to make sure that our children stayed connected as much as possible. And I remember having one particular visit where there were multiple kids in school, a DPSCD school, and everyone had their computers. So I had half the children in one room and I'm examining one at a time so that they wouldn't miss their class. So we're definitely reaching out, asking the parents to make sure that they know what's going on in the school, and making sure that they are partnering. Email the teacher if you understand. I have a lot of teachers who are working with us, and we have to pray and lift up those teachers because they're amazing what they were able to do during the pandemic. I teach, at the time I had 600 students under my watch at the medical school, and I had to switch myself to an online platform. And I had a little bit more time, sort of, but I was also in clinic too. So it was still an amazing feat to be able to bring our education to people who are learners and really desperately need this information. Another way we actually a challenge I saw early on is there's no gym class at home. Mom doesn't want you to run in her house. Everybody knows that's rule number 1. Stop all that running in my house. So because there was no running in the house, and because we really didn't go outside and go to the park and do those things, then we kind of just ate for comfort. A lot of us did. And so there is also an epidemic with children. Now they've gained a little too much weight, 20 to sometimes 100 plus pounds over the pandemic. And now we have to deal with the diabetes and the things that are coming along in children that we didn't anticipate before, because children really do need gym and recess and to walk back and forth. So that was something that we're dealing with. Mental health as well. Some children really don't do well with isolation. If you have an only child, they don't have brothers or sisters, there was no interaction. So what we're seeing for the littlest children who would normally have been in Head Start and communicating, they didn't have that interaction. And now they're trying to go to school, and now they're away from the parents that they've seen every day for the past year. So that's been a challenge for them. I think that identifying the challenge is only half the battle. Identifying our partners in the community to help us through those challenges will be the real issue that we need to tackle.
Well, Dr. Allen, thank you so very much for those remarks. I want to bring Angelique Peterson Mayberry back on and listen. I want all of us together to have this conversation as we talk now a little more in depth about the vaccines and how that affects children. What are some of the frequently asked questions? For all of you that are out there, this is Bishop Edgar Vann. This is the Vantage Point. And tonight we are talking about what about the children as it relates to vaccinations as it relates to the boosters, as it relates to the new variant that's out along with the Delta variant, the original COVID-19, and certainly the flu season, which we are in as well during the wintertime. It sounds almost like, from a health standpoint, a perfect storm. And so we want to get into some of those questions and really how we can pull this together with the schools, certainly as a partner, with parents, those of you that are on the line tonight with us. I know that you want this information. Dr. Allen, is the Pfizer vaccine safe for kids?
Absolutely. And I say that as a mother, which is actually how I speak to my patients. As a mother, is this something that I want to go out there and do? Whether as a parent, as a grandparent, we have so many reasons to worry about our children. And the fact that there is a disease out there that at early, we know very well, too well in Detroit, that actually children did die from having COVID. And having one less thing to worry about, you're going to go to school and be a child and not necessarily wash your hands as often and keep the mask over the nose, like we say as parents all the time. The Pfizer vaccine has been tested and it is absolutely safe for the children. It's been tested in trials that have been happening across the country. The trials have involved a diversity of people, which was very important to the people who were looking at it. We didn't want to just bring just certain kind of people who happened to be hospital employees, children. It's community members who were volunteering to sign up to really address this issue. And once they addressed it, are there questions? Absolutely. What do we do as parents? Is this safe for my child? COVID's not safe for your child. And for me as a child, I wanted a little bit more control. I want to know what's going on. So as I took the vaccine, and I did take it last December, so I was one of the first as a first responder. And I thought, you know what, every day I'm running into parents who are very well meaning. But if you're a parent and you have COVID and your child has a doctor's appointment, do you know what the parents are doing? They're coming to bring their children to the doctor with COVID every single time. And I do not blame them. Keep your kids happy. I dedicated my life to this as well. But on the same time, I'm also being exposed. And I'm also exposing my family that I go home to. And there were too many close calls. So just to have a little bit more control back, I decided to get the vaccination. And then once I got the vaccination, I started encouraging my colleagues to do that. We felt better. We felt a sense of relief. Did you know that the vaccine was completely going to keep us from getting COVID or dying from it? No, we didn't, but we just took a little bit back, and that was okay for us. And then as I tell my parents now, almost all of us have a vaccine in the healthcare system. I think the last hospital system is going to have their deadline soon. So at this point, if you live in Detroit, where there are a lot of hospitals, you probably know someone who had the vaccine, and we're doing okay. We had side effects, but we're doing okay. Our children, they're lining up to get that. Do you know why? Because your children want to go to school. they don't necessarily want their mom and dad to be their teacher anymore. They want to see their friends. They want to have a wonderful life. My son is always saying, can I go see the Lions play now? And I say, we'll think about it. But, we're keeping them safe and we're trying to go back to normal, and getting this vaccine is the very first step to do that.
One of the great things I think that happened in the city of Detroit was the accessibility and the availability of vaccines. I know myself and Reverend Anthony, we were the first two places, community places, where the vaccine was placed last February, first week of February last year. And there were others that, of course, were added, other sites, even mobile sites that were done. I'd like to ask Angelique Peterson Mayberry, has the Detroit public school system been a place where kids can get the vaccine?
So yeah, Bishop, we've actually partnered. We've had a couple of vaccine clinics. The next one will be on December the 5th at Martin Luther King or at Renaissance, but we have partnered with the city and some of our churches to make sure that our parents and our families cannot use that as a reason as to why they aren't getting this done. One thing that was amazing that we saw during this time, and I know Dr. Allen talked about this before, about just how resilient our kids are, and they're leaders. You know, they're just leaders. We started a program called Teens for Vaccines, and we had young people who wanted to take the lead. And so we stepped back and supported them from the back to let them know that we were supporting them, but there were forums, there were medical experts on these forums. They kind of took the show on the road. They went to a couple of different places and had, you know, online accessibility, and we attended them, and they were amazing because they said that they too wanted to be a part of the solution. Now, this was done last summer when the ages were 12 and up. So now at 5 and up, we are making sure that we do not use the excuse that they aren't accessible. We know that adults have to come in with the young person so that they get the vaccine, to make sure that, you know, the legal guardian is who has approved the vaccine for the young person. But I think Doc was absolutely right. On the first day of school, I'm in the schools often, and I don't know if people know, but, you know, school board, that's a volunteer position, right? Yes, elected, but it's no pay associated with that. I work at Ford, but I'm in schools, and in the first day, it was amazing, Bishop, to see young people this fall back in the building. They were masked up, but they were so excited to be in the building. And I think it speaks to the fact that that social emotional piece that we talk about, that's real. Being in other people, we are social creatures. And so when that doesn't happen, we start seeing the effects of that not happening. So our young people, we were making sure that we were trying to normalize life as much as possible during COVID with safety protocols. So yes, we absolutely are making sure that we've had robocalls, we've had forums, we partnered up with DFT and had a forum where we brought in medical experts in that as well, so that the members of DFT and all of our unions are able to ask questions, because we understand that there's fear that still exists. And, you know, like Dr. Allen said, there's a fear of COVID. Yeah, there's fear of vaccine, fear of COVID. But we know that there's also vaccinations that our young children have to attend school anyway, right? And these aren't new vaccines that people are having to make sure that their young people have to come into the schoolhouse. So, you know, let's find out everything that we can about the vaccine for your comfort level. Am I vaccinated? Absolutely. Was I running as number one? No, I was not number one, right? But I understood that not only do I have influence, but as a leader as well, get all of the information that I need so then I can make the informed decision and transparently share with people what my fears were and how I overcame those fears.
Great. You know, I know I'm the oldest person on this.
The wisest. You're the wisest, Bishop.
On this forum tonight. But listen, I remember when, you know, vaccines were just a way of life. I mean, this is what we did. It had not fallen into the political shenanigery that is out there right now with, you know, this becoming wedge issues politically, et cetera, et cetera, et cetera. Of course, there was no social media, so there weren't people with misinformation that misguided my parents or anything like that during that time. But Dr. Allen, I really want you to address a couple of the most asked questions. Number one, you know, not only is this effective, are there long-term effects when young people and children get the vaccine? What about children that have allergies or some sort of pre-existing condition, or could very well be immunocompromised? And I've also had this question to come in, and I'd like for you to address it, Dr. Allen. What about women who are childbearing age and who are seeking to have children and families? Should they get the vaccine as well?
Absolutely. So let's start back by talking about the long-term effects with these vaccines. The first thing I always say in my clinic is that the vaccines that are out, we've all had, and the same long-term effects we've had from them, which no one can name any at this point, are the same ones that we should be expecting from this COVID vaccine. Granted, to be completely honest, we of course rushed to get this vaccine out there because people were dying and more people were dying than we would have liked to say. So this is our solution to keep people. The vaccine for children from 5 to 11 is 90% effective in making sure that those children launch an immune response, meaning they can fight COVID when they actually get it. So that's a safety that I'm going to hang my hat on. In terms of the side effects of it, the side effects of the vaccine short term, because my children, my patients always want to know, it's going to sting, or it might not sting. Both times I had mine, I felt nothing. But later on, you might have a sore arm. You might have a little bit of a fever for 1 or 2 days. How long are you going to have COVID if you get COVID? It's not going to be 1 to 2 days. It's going to be a prolonged. And sometimes they have long haul COVID where people don't regain their sense of smell or taste for months afterwards. And we don't know when that's going to come back. So the vaccine gives us an opportunity to stick with some knowns here. In terms of if you have allergies, the typical things that people are allergic to are not in this vaccine. So we don't have to worry about, well, I'm allergic to egg. Well, it's not an egg product vaccine. The way that I explain the vaccine is, let's say Thanksgiving comes around, everyone loves their Thanksgiving pie, but let's say that pie made you really, really sick. The vaccine has just a couple of components to have your body recognize that there's COVID near you and it launches an immune response. So it'd be like recognizing the crust of your favorite sweet potato pie that you just had. You don't eat it. It's not going to be good for you. It's not going to resolve in anything. Your body fights against it. That's what this vaccine does. So we're not infecting anybody with the vaccine, which is a common misperception that people have. It's just a portion of it so that your body can recognize, so that it launches that immune response. In terms of asthma, if you have asthma, which is definitely a big problem with our children, your lungs are already taking insults from common colds and cold air. It's wintertime, the flu. The vaccine, if you don't get the COVID virus, then you will do a better job with your asthma, which you're not going to get rid of anytime soon. So we want to protect those who are immunocompromised. Your immune system is likely to respond to a little portion of the vaccine. You might not have as good of a response as those who have a fully intact immune system, but you will launch something. And so we need to keep those children safe, but more importantly, the people who are their caretakers, we really encourage them to get the vaccine because you don't want to bring something home that your child could not fight off on their own. And then the question, I did have several people talk about their menstrual cycles and how that's being affected by the vaccine. There really isn't definitive evidence that the vaccine is what's causing that, but we do know as females that stress impacts your menstrual cycle, being sick impacts your menstrual cycle, working out too much will impact your menstrual cycle. We have not seen any long-term effects, though, of COVID vaccine impacting the menstrual cycle for the females.
So I want you to address the question, though, about childbearing women who are trying to get pregnant,
Oh, yes.
or are childbearing age. And many of them, some of them have reported they have a fear that if they take the vaccine, this will affect them one way or the other.
And I do understand that. Women who are pregnant are highly sensitive about what goes in their body because they are carrying a child. We have encouraged women who are pregnant or trying to get pregnant to take the vaccine because you also need to protect your child. We have seen some early evidence that those women who contract COVID, because the body isn't launching an immune system, sometimes they are having issues with their pregnancy. Miscarriages is what I'm referring to. So we're not sure how that is actually working, but we have seen in that women that have a vaccine, their children are protected. And as for right now, we do not have a vaccine for newborns to 5 years old. So there is no other protection that you can provide for them. Just as we always encourage women to breastfeed if possible, because that confers a natural immunity, we do believe that once they receive the vaccine, that immunity will also be passed on to their child as well. So we have not seen any adverse side effects.
Great, great, great. I know that from a community level, Angelique, you have probably heard every excuse possible for people not getting the vaccine. Again, telling my age, I remember when, you know, there was tuberculosis and smallpox and diphtheria and polio and all of these diseases, which were literally or virtually wiped out here in America because all of us were required to take vaccines. These are not diseases that you see. You don't see chicken pox. You don't see mumps and measles and things like that as you did as a course of life back in the day. It's because of vaccines itself. Maybe there's some excuses, or maybe there's some concerns, I should say, that parents have had about the vaccine. And do you think that if a parent has not received a vaccine, that they would make sure that their children would receive one?
Absolutely, Bishop. You know, and you're right. You know, some of the reasons that people say that they're not getting the vaccine. I know another one that was used all the time was, oh, it's like the Tuskegee. That's like the experiment, right? Oh, it's like the experiment. And so, you know, when you think about, and I know there, I call her Dr. Kiki, who was one of the instrumental doctors with Moderna, you know, thinking about, well, you know, we heard, well, it's not for Black people, you know, there's a lot, you know, oh, it's, you know, what about, you know, the people in poverty, they're trying to eliminate poor people in urban cities. I mean, we've heard so many reasons that people say that they're not getting this vaccine. And, you know, that is why now the conversation, as we think about it, if you think about, so DPSCD has approximately 48,000 students, a little under 48,000. And since school began, we've had over 5,000 students who've had to quarantine. So when you think about quarantining, these are students who were not vaccinated. And so they're losing educational moments because, you know, when they're at home, maybe nobody's at home to ensure that they're logging in. We heard Doc mention that earlier, or making sure that, you know, your camera's on. Are you good? Did you turn in your assignments? Things of that nature, because parents work. They have to work. And so we want to make sure that you know, and we think, and we encourage parents, this is the best way to allow the educational environment to not be interrupted, you know, and that is the only thing that we can say. Have we had outbreaks in the schools? Absolutely. We've shut down schools, we've shut down grades, you know, a particular grade, you know, there's activity that happens on the weekend that comes back to school on Monday, you know, and so when we think about it, but the reason, Bishop, I like to highlight that we're seeing some of these outbreaks is because we're testing. And so no other district is testing like us. With universal testing, of course, you will identify where there are positive cases. And so, you know, spending $70 million a week on testing is not something that we can sustain. We know we have COVID dollars right now, but that is until 2024. And so this isn't something that we're going to be able to sustain at scale like we're doing right now. And so if we think about, as people wrap their minds around education during COVID, what is the best way to ensure that you are doing your part, right? Because there's a part that you can play in this. So if you're doing your part, we're going to try and do our part, which means that every safety protocol, you know, and I had to say this to somebody who said, well, I'm not coming into the schools. Well, I saw you at Shane Park. Now, wait a minute. Now, you were at a concert at Shane Park. You know, you didn't have a mask on, but we're requiring masks and temperature checks and, you know, all these different things. And now you don't want to come into the school. So, you know, we just have to be careful. Our young people are watching us. Be careful of the message that you're sending, because, you know, they too start to gravitate towards those stories that you create. So yes, we are encouraging the vaccine. Do your research as to which one you want, you know, and I know some of them get a better rep than others, but if you have none, then that's a whole different story. And so do your research as to which one you are more comfortable about. I'm a child of the Most High. I had to really pray about this thing, and I had to have peace about getting this vaccine. And I'm unapologetic about that because I try not to make moves without him. So when I got peace about getting it for myself, I was able to share that and ask people to do the same thing. Go to your whoever you go to as your spiritual advisor. Go to them and get that comfort that you need so that you're at peace with it. But it is extremely difficult to say that, we don't do this, but yeah, we're doing other stuff to our body. Medications, look at your Advil, Aleve bottle. There are, side effects that could be, happen with that as well. People getting tattoos. I mean, I could go on and on about what we're doing to our body. And yet we don't know what that stuff is doing, but yet something that is put before us to try to stop this pandemic that has taken way too many lives. We have a lot of reasons why we are not entering the space of comfort with it.
Yeah, I've heard some of the most double-sided, hypocritical excuses that people have. Again, I don't want to come in a school. I don't want to come in a church. I don't want to go to the doctor because I might get COVID, up there with other people who are going to see the doctor. And these are the people, 110,000 people were at the Michigan game, and probably another 50,000 were out tailgating. They all came down. It was just a sea of humanity at the end of the game. No one was talking about, well, I don't want to put COVID in my body. I don't want to be around anybody that may have COVID. No one was saying anything like that. They were caught in that moment. They're going to concerts, they're going to this, they're going to that. And we won't talk about some of the other places people are going. But we know
without masks too, Bishop. I didn't see masks at the game. I watched it, but hey,
And I'm just saying that some of the sort of things, I don't want to put anything in my body. Those chicken nuggets, you don't know what's in those. You don't know what's in that candy and that processed meat that you're eating and all kinds of other stuff. We who are people of faith, we have a faith foundation that we believe guides us as we do whatever we do, and we figure that we're covered because of the faith in God that we have to heal our bodies. There is a difference between faith and foolishness.
That's right.
I think it's important for us to understand the true dichotomy of that it's important for us to be good stewards of our bodies. I'm talking to spiritual folk out there.
That's right. That's right.
Everybody's welcome.
Amen, Bishop. Amen.
But I'm talking to the spiritual people out there. I'm talking to the people who say that they walk by faith and not by sight. I'm talking to you and saying, it's important for us to be good stewards of these bodies that God has given to us. And so we, of course, are promoting that you get this vaccination yourself. And we're also promoting it for your children. It's now available, am I right, Doc, from age 5?
Yes, sir.
All the way up. And so it was 12, the teenagers. Now it's the children. And you're hearing tonight from experts that are letting us know what's available to save our children. We want them educated. We want them safe. We also want them healthy. We want a healthy community. It's about community health. And Doc, could you just address, though, I know that when the pandemic first started, there was this term called herd immunity. I didn't like that term, so I turned it into community immunity.
Yes,
but we there was a certain level of vaccination saturation that needed to happen in the general population for there to be a true impact upon the spread. These viruses, speak a little bit about viruses. These viruses have their own minds. They have their own proclivities. They are active viruses that are, in a spiritual sense, seeking whom they may devour in a way. And we have not really reached that, especially here in Southeast Michigan or in Detroit specifically. We have not reached anywhere near that where people are double vaccinated, fully vaccinated. There's so many that got the first shot and never got to the next one. And we're now in a place where we're asking people to get boosters. I got my shots last January. So it's booster time. So the thing is that talk to us about the nature of a virus and why does it spread in the way that it does?
Absolutely. So the virus, you're right. It has a mind of its own and it wants to impact and survive. It's the instinct that it has. Right now in the United States, 39% of all the COVID vaccine or COVID diseases are happening between our children who are 5 through 11. Why? Because most of the rest of us received at least one vaccination. So our chances of getting it are a lot less. But because the virus wants to survive, it's going to jump into wherever it's going to allow to survive. Now, viruses don't actually replicate themselves to the standard that they probably do at Ford or GM, the same standards we use to make our vehicles, where we do things the same way every time to make sure that it's exactly the product that we want. Viruses might have an error here or there, and it's those errors that actually produce variants. So that's why we have the Delta variant, which is very prevalent in Detroit right now. It's not the same COVID that we had back in January. It's a new kind, which is slightly different, which is why there might be a little bit of difference between what the vaccine was covering and why some people may still get the Delta variant, even though they are fully vaccinated. So what we're trying to do is stay ahead of the virus because it keeps changing. Omicron is coming. It's changed again. So it's not Delta and it's not the original COVID. It's something new. Will the vaccine prevent you from getting it? Maybe, maybe not. But is your body going to launch an immune response against COVID, period? Yes. And that's what we want. We do not want to go back to the fact that we're redoing our arenas and changing them into hospital systems because we have no protection against the virus. That is a big problem that we're trying to prevent. Now with our schools, I can tell you if it's 39% are ages 5 through 11, those are elementary children. They're going to school. We did not give an option for them to be protected, and now they're bringing it home to the rest of us. And so until we can get them vaccinated at the level, which Henry Ford went live about a little over 2 weeks ago. And honestly, our appointments are filling up. So it's definitely someone is coming in to get these vaccines. You definitely want to make them available, but we don't have a lot of capacity to keep giving out the vaccines. What the real issue is, Bishop, is that in our community, we need to just address this distrust that we have. And we need to just call the healthcare systems and say, you know what, here's what happened to my family member. And we need to be real and say, I'm very sorry that happened. We had a system in place and we failed. Tuskegee studies, which was mentioned earlier, that was a different time period completely. That was an attack. The government apologized. They actually admitted we did something wrong and we were absolutely wrong with that. So I think that we need to get our doctors out there and say, hey, there are doctors like me who receive a vaccine. We want you to be healthy. We want to make sure that you're not the one in the hospital by yourself, literally. And it's the end of your life because you made a decision that wasn't well informed because of distrust that happened long ago. I'm sorry. Let's go out. Let's get in the community. Let's talk about this to get this done. Herd immunity. I think our vaccination rate for Michigan is around 54. So a little less than half of us have done what we need to do to get it up there. And if we want to go back to these various concerts and venues and fill out all of our arenas, then we're going to have to do a better job. Or every time you go there, you're going to be putting yourself at risk that you don't really need to do.
Yeah, that's great. That's great because I think it's important for us to get the information. This is why we're doing this tonight. And I am just so grateful to you both for sharing some time tonight, sharing your expertise, sharing your experience with us, because you've got to be informed. And you need to be informed by reliable information as well. We've got to know that anybody can make a post on social media and say anything they want to say, and it does not mean that any of it is true. And so you've got to get reliable information. This is why this forum has come to us tonight. And this is why Dr. Allen and Angelique Peterson Mayberry have come to us tonight to make the plea to our children, and most especially to those who are responsible for them, their parents, their guardians, their families, that it's so important for you to give the highest consideration possible to getting this vaccine. Vaccines and viruses will not cease. The only thing that happens is that we build up a sense of immunity against them. They're always active. They're always, it's kind of like the enemy, you know, it's kind of like the devil. It's always there, but you build up a resistance against it. And we can build a resistance together because our collective resistance is what's going to make the difference in the spread of viruses. Viruses begin to mutate. This Omicron variant already has 30 plus mutations. That means that there's all kinds of ways in which that particular virus can be highly transmissible. We want to try to do what we can in our community to keep our people safe, to make sure that our children are safe, to make sure that they have an opportunity to go to school and to be safe and to be healthy. We want a healthy generation coming along. We want to make an investment in this new generation that they might have everything that God intended for them to have. And so it's important. And we've had a great forum tonight. Hopefully we have answered many of your questions and hopefully given you an opportunity really to decide, to make a true decision toward what you need to do for your children. It's about them and it's about you. So I want to have some a final word from Angelique, who is sharing with us, the president of the Board of Education for Detroit Public School Community District. And then we're going to have a final word also from Dr. Nakia Allen of Henry Ford Health System.
Thank you, Bishop. Again, thank you for this opportunity. I hope it's not the last time I can come and talk about what we're doing in the district, because I think people need to understand that we are doing everything that we can, as you know, in terms of cleaning the building, the filters in the building. We know some of our buildings are older, so we are working with the CDC and the state health department, the city health department, to make sure that those are safe learning environments. So that's the first thing. The other thing I would say is that, you know, the conversations are going to begin around mandating vaccines. You know, we cannot avoid that conversation, or we will continue to have this conversation where we are constantly saying that we still only have 50-something%. Like, we can't continue to have those conversations. We've seen it in other school districts. And so now we are moving to a conversation in our school district as well. What does that look like for our staff, our students? So no one should be surprised. You should actually have expectations that we too are going to be having those conversations. Lastly, I'll just say again, December the 4th, I think I said 5th earlier, but December the 4th, vaccine clinics, Martin Luther King Renaissance High School. Even if you're on the fence, come and talk to people to get more information, because those people are also present. So ages 5 and up, please, please, please. This is the only thing that we have control over when it comes to our body in this vaccine. So again, Bishop, thank you so much for the opportunity. And thank you for your continued support of our young people in DPSCD.
Thank you so much. Dr. Allen.
Yes, sir. I just want to end the night by saying this is a community effort. And anytime we come together as a community, we are always successful. I don't want to have this face of the health system and we just want to get you vaccinated. That's why I really want to focus on all the other things we're doing. We really are supporting you and your children in your schooling and making sure the academics. I'm there to keep you healthy, but part of that means you're academically sound, you're mentally sound, you're physically fit, all those different things. The vaccine is just a relatively small and easy and quick component for you to actually be the best you that you can be. And I'm willing to answer questions with parents. You know, we don't always make the right decision, but not getting the vaccine might not be the right decision for you. At this point, do what you can to take control of your house and what happens in there. And we are doing so many great things. I really just implore everyone to consider the vaccine for themselves. At Henry Ford, I'll do both. So if you come to see me, I'll give your child a vaccine and give you one too. And y'all can stay in the room together. You go first, parent. You go first. But we will do that. And we're really there to stop and talk to you and really answer those questions as best we can. So please call your healthcare providers, your schools, go to the area clinics, wherever you can, ask your questions and go ahead and get the shot. It's going to be worth it, especially with flu coming too. You all, we don't want to go there. So please just do whatever you can.
Well, we've had a great forum tonight. This has been the Vantage Point. What about the children? We've explored tonight the necessity of children getting vaccinated so that we can stem the tide of the viruses, the variants that are out there that continue to proliferate in our community. We want to make sure that as a people, we can at least come together on our health, on our welfare, on our safety, and of course, on our economic empowerment as well. But it's important for each of you to make sure that you're in a point of decision, that after you've considered all the facts, that after you've done your research. You know, I always say that there are 3 people that you need to talk to about a vaccination. Number 1, you need to talk to God about it. Number 2, you need to talk to your medical professional about it. That's why we bring medical professionals to you. And then number 3, you need to talk to yourself about it. Don't neglect that conversation that you need to have with you about your future and about the future of your children. This is Bishop Edgar Vann. We've had a great time tonight. I hope that you have been helped. Drop your comments in the comment area, if you will. Share this, like this. Of course, make sure that you are sharing this with someone else. It'll be on our platforms, both Facebook and YouTube, and you'll have the opportunity to go back and to look at it again. To Dr. Nakia Allen and to Angelique Peterson Mayberry, we love you. Thank you so much. Good night.
Good night.